Dear students, let us discuss about the sternoclavicular joint. The shoulder girdle consists of sternoclavicular joint and acromioclavicular joint. That means these two together. That is the sternoclavicular joint and acromioclavicular joint together constitute the shoulder girdle. Coming to the sternoclavicular joint, it is the joint that connects the upper limb with the trunk, and it is a very mobile joint and facilitates a wide range of movements at the shoulder girdle. Structurally, it is a saddle type of synovial joint, but functionally, it is a ball and socket type of synovial joint. Let us see this picture. You can see the articulation between the clavicle and manubrium of sternum, and there is articulation of first rib also with the clavicle, and you can see the articular disc separating the clavicle and the manubrium of the sternum. You are seeing the ligaments in relation with the sternoclavicular joint. It is the anterior sternoclavicular ligament anteriorly, and correspondingly posteriorly you will see the posterior sternoclavicular ligament. There is costoclavicular ligament connecting the first rib with the clavicle. There is interclavicular ligament which will be seen in relation with the suprasternal notch, and it runs between the medial ends of the two clavicles. Hope this is clear to you. Now let us to the articulating surfaces. Now recollect the bones that are articulating, that is the sternal end of clavicle, manubrium of sternum, and part of first costal cartilage. Now you have seen the articular surfaces are covered with fibrocartilage. The joint is divided into two compartments by a fibrocartilaginous articular disc. Enclosing the joint, there is the outer fibrous capsule and inner synovial membrane. The fibrous capsule will be extending from the epiphysis of sternal end of clavicle to the borders of articular surfaces and the articular disc. The synovial membrane will be lining the inner surface of the fibrous capsule, and it produces synovial fluid, which reduces friction between the articulating surfaces. Coming to the ligaments that provide more stability for the joint, the ligaments are the anterior and posterior sternoclavicular ligaments that will be strengthening the joint on the anterior and posterior aspect. The other one is the interclavicular ligament between the sternal ends of clavicle that reinforces the joint capsule superiorly. We are seeing the costoclavicular ligament between the first rib and cartilage below with the anterior and posterior borders of clavicle above. This is a strong ligament that stabilizes the joint. Coming to the blood supply for the joint, it is by internal thoracic and suprascapular arteries. The nerve supply is by medial supraclavicular nerves and nerve to subclavius. What are the movements of the joint? So, it facilitates movements at the shoulder girdle. So, there is high degree of mobility for the shoulder girdle provided by the sternoclavicular joint. And the movements occurring at this joint are the elevation, depression, protraction, retraction, and rotation. Elevation is upward movement of shoulder girdle, and depression is downward movement. Protraction is anterior movement of shoulder. Retraction is posterior movement of shoulder. And rotation, that is raising the arm over the head. So, how you can describe these movements? Elevation is by shrugging of the shoulders or abduction of arm over 90 degrees. This movement is checked by the ligaments and articular disc. Depression is the moment where there will be drooping of the shoulders or extension of the arm with the shoulder behind the body. Now, this is checked by contact between clavicle and first costal cartilage. The protraction is an anterior movement of shoulder girdle, which is checked by anterior sternoclavicular ligament. Retraction is the posterior movement of the shoulder girdle, and it is checked by posterior sternoclavicular ligament. The rotation is, as you know, raising the arm over the head by flexion. So the clavicle will be rotating passively as the scapula is rotating. And this movement is transmitted to the clavicle by the coracoclavicular ligaments. But the costoclavicular ligaments act as a pivot for movements of the clavicle. So now we have understood about the type, subtype of sternoclavicular joint and the bones articulating the ligaments and the movements and how they are checked. The applied importance of it is dislocation of sternoclavicular joint, which is rare because it has got strong ligaments. The anterior ligament dislocations are 20% more common than posterior dislocations. The posterior dislocations, though they are rare, once they occur, they are serious because they are involved in the structures in the thorax posteriorly. That is, the esophagus is there, the blood vessels are there, the trachea is there. Hope you have understood about the sternoclavicular joint.